distinguished guests, and fellow advocates for a healthier planet. This is Khaja Hamad Akbar here. I am the member of Central Consultation Council and Secretary General of Pakistan Health Parliament. Welcome to our virtual symposium on environmental health, addressing the contemporary issues faced by Pakistan and exploring the way forward. Today, we embark on a crucial journey to dissect the environmental challenges that affect the health and well-being of our nation. Let me introduce you first what is Pakistan Health Parliament. Pakistan Health Parliament is a platform which bridges communities, patients, healthcare providers, and policymakers through dialogue and innovation. Pakistan Health Parliament shapes policies for equitable access and quality treatment. We just not aim to produce better health, but also future health leaders. Together, we aim to build a healthier nation where voices are heard and wellness thrives. Our vision is to make Pakistan a country with health acumen. Today, we stand before you to address a matter that transcends borders, politics, and ideologies, that is environmental health. The state of our environment is linked to the well-being of every living creature on this planet. It is a shared responsibility that requires collective action and a profound understanding of the impact our choices have on the world we inhabit. Let us acknowledge the interconnected web of life, our air, water, soil, and the diverse ecosystem that sustain from the delicate balance that nurtures life. However, this equilibrium is under constant threat due to human activities. The air we breathe is tainted by pollutants. Our oceans are drowning in plastic. And our forests, the lungs of our planet, are disappearing at an alarming rate. The consequences of these actions are not distant threats. They are evident in the rising prevalence of respiratory disease, water-borne illness, and the loss of biodiversity. Pakistan stands at the crossroads where rapid urbanization, industrialization, and population growth intersects with the delicate balance of our environment. From air and water pollution to deforestation and climate change, the challenges are multifaceted and demand collected attention. Our purpose today is not only to shed lights on these challenges, but more importantly, to explore sustainable solutions and chart a way forward. This symposium serves as a platform for collaboration, knowledge exchange, and the forging of partnerships that can drive positive change. We are honored to have a lineup of distinguished speakers, experts, and thought leaders, each bringing a unique perspective to the table. Through their insight, we aim to build a comprehensive understanding of the complex environmental health landscape in Pakistan. This symposium is not merely about identifying problems, but more importantly, about exploring tangible solutions. Together, we will discuss policy frameworks, community engagement, technological innovations, and actionable steps that can pave the way for a healthier and more sustainable future. Let's begin the symposium with the message from our Ambassador of Pakistan Health Parliament, Mr. Kashaf Alvi.
Urgent action is needed for assistance. Pakistan faces a severe environmental crisis. Air and water pollution, poor waste management, and lax regulations. Urgent action is needed for a sustainable future. Join our 1,000 plants drive in Islamabad that sows seeds for a greener future. Every plant counts. Embrace change for a healthier planet.
Our first speaker of the session We'll delve into the medical and public health aspects of the environment, discussing its impacts on human health and strategies to mitigate health risks. And Dr. Zafar Fatmi, he is the head of section of environmental health and climate change, Aga Khan University Hospital. Sir.
Assalamu alaikum, colleagues. Assalamu alaikum, and good evening from Hyderabad. I hope you can hear me. In brief time, I'll try to introduce you to the air quality and water quality and some of the challenging issues which Pakistan is facing currently. Certainly, I'll miss out on many things with the limited time I have here, but hopefully we'll cover that and something in that discussion as well. So I'll try to share my slide here. You can see it. Please let me know that you can see that. Is that visible?
Yes, sir, it is visible.
Great. So environmental health issues or environmental issues is generally overwhelming whenever we think of, and now there is, in addition to environmental health issues and environmental issues, is the climate change. And that just adds to the burden of environmental health issues because climate change work through these contamination, air quality problem, water quality issues, food contamination, and all of that. So it is becoming much more challenging and complex to address that, in particular for the countries like Pakistan. So my outline of presentation is I'll focus on ambient air pollution. Lahore and Karachi are examples, these are global examples, in fact. Household air pollution is a particular example of Asia and Africa is a huge concern for Asia and Africa countries and lower middle income countries like Pakistan. And at the end, I'll talk about water quantity and quality and health concern. In between, I'm talking about what are the potential solutions as well as what are the impacts on human health. So if we look at, this air quality thing, it's all about burning, whether you're burning in your mouth, whether you're burning in the kitchen, whether you're burning in your vehicles or you're burning fuel in the industries. It's not visible at the bottom, but 60 to 90% of the chemicals which are released in these burning are similar. The differences are that amount of burning in a cigarette is small. It has nothing to do with the environmental contamination. But obviously, it's closer to the lungs and closer to the heart, closer to the body causes. That's why it causes huge health impact. Similarly, burning in the kitchen contributes to like about less than 10% of the global climate change as well as air pollution. But it's burning very close to the women and children in the house, particularly of the women who are in the rural households, and that's why it causes health burden, high health burden. And the bigger burning, which causes climate change and wider air pollution, obviously industries and vehicles. So we know this is Karachi, image in a road, and this is how it looks like. But climate change is just complicating the air quality issues because whenever we burn, it's not only the air pollutant which are released, which is NOx and SOx and ammonia and carbon monoxide, etc., but also the greenhouse gases like carbon dioxide are released. And these interactions are complex and it impacts the human health, but also the plant health and the vegetation and the building and infrastructure overall, which is a higher burden in terms of economic burden to the society. So this is the city of Lahore, where which is the focus these days and for the last several years. We looked at the longitudinal data on Lahore, and you can see that there is a huge increase from 1998, around 62 microgram per meter cube of particulate matter 2.5 to about 88 micrograms per meter cube by 2020, which is a steep rise in the air quality, and that's where in particular in the winter it becomes not livable in this city particularly. So this is the graph showing the same data and how it has changed over time. And in the space of Lahore, particularly the central part of that Lahore or central part of the city where it's more congested, or the older Lahore. And this is a little more detail about, we have done some air quality deterioration, and one of the reasons obviously road density. And we can find hotspots within that as where these air quality are much more problematic than other areas. So air quality causes respiratory cardiovascular, and we have been hearing that for several decades now, in fact. But it's a recent study which shows that an estimate of about every 10 microgram increase in particulate matter, it leads to 3% increase in pregnancy losses, which is miscarriage and stillbirth. It also the evidence which reduces the low birth weight and all of that. So and climate change is just complicating that issue. So the amount of the particulate matter which goes up to 300 and up to 400 sometimes in winter in Lahore. It has been estimated that children born in Lahore today are losing average of 5 years of life due to their air pollution. This is Karachi. Karachi is little, the emissions are much more probably from Lahore, but because of the sea breeze and other elements, the concentration doesn't go as high as in Lahore, but it's quite high, like 250, 200 is quite normal. And we have conducted several studies in Karachi, where we have looked at as the concentration goes up from 550 to about 200, the daily admission for cardiorespiratory diseases in hospitals increases from 20 to 70% in the city, which is a huge burden. And this is, again, Empress Market of Karachi. And you can see this is how it is in the COVID. And we did some measurements and look at the available data, in fact, the secondary data, and we saw a sudden decrease when the lockdown was implemented. Even during the lockdown, the levels were close to 80 to 100 micrograms per meter, and that was alarming. The reason was there was no large vehicle, there were no big industries working, but it's still 80 to 100. And that's where we started investigating and thought that, there's this socio-economic condition of LMICs where small businesses are also operating and the household emission is still going on, still emit quite a lot of like generators and other things, which is much more challenging to address the problem. It's not just large vehicles, not just large industry, the small industries, as well as emission from the household, which contributes to the air quality. This is I'm just started investigating this. So black carbon, or the soot part of the particulate matter. And this is kind of December 2022 Lahore and Karachi data. The upper line obviously is Lahore, the red one, and the lower one is Karachi. And you see is an interesting pattern. So it starts with the midnight. The levels are quite high, and then it goes down, and then around 8 and 9, it is at the lowest level, 9 a.m., and then it goes up gradually till the end of the day by 11 or 12 o'clock midnight. What it shows that there are vehicles, their operations within the day, which actually increases the black carbon. And that's where we have been saying where it is coming, where it is coming from. It's coming from east, it's coming from west, it's coming from within. And this is similar pattern, but much lower in the Karachi city. And this is June, similar pattern, but the levels are lower and much lower, but the pattern is the same as according to along with the timeline of the day. I'll just go on with three things from here, with this kind of air quality. One is the population, which is a major problem. So 230 million people. Karachi population, which was 0.5 million and 47, 94.7, so 30 million people is still debatable. But about 5,000% increase in 50 years, which is unprecedented. In the same time period, like New York just grew 5%. And this is a population, similar population, about 25 million live in all of Australia. So this is one reason of this deteriorating environmental health condition. And that's where we need to address that problem with population policy. The other thing is the transport policy. The old vehicles, the two-stroke engines, and all of that is just, Karachi is the only city, probably don't have mass transit. It's the only mega city globally which doesn't have any mass transit. And then the third policy, besides the vehicular policy, you need to have industrial and energy policy. So what kind of old industries, vehicle policy and renewable energy policy, so which direction we have to take in order to reduce the air pollution. It also leads to regulatory issues, and which causes huge problems like water contamination as well as air emissions. So simple solutions we don't understand, the mass transit. So the 40 people in automobiles using a lot of fuels, a lot of space, and it's a burden on economy and individual. And the 40 people in the mass transit below in a bus, which uses less fuel than 40 cars, obviously, and much less space. We don't see that simple solutions, and there's no way forward on that. But this is what it is, as I said. So moving on to one of the issues, which is our lower middle income countries' issues, is the household air pollution. Burning of solid fuel, wood, cow dung, animal dung, agricultural residues in the kitchen, about more than 51% or 49%, from the Pakistan Demographic Health Service says that household in Pakistan still use wood and cow dung and all that. It produces a lot of emission if it is burned in a traditional stove, and lead to, so compared to, it's a little complex slide, but what I want to show here, the vertical line at the very left are the standards or the values of ambient air quality. So ambient air quality concentration is around like 0 to 300 or 400, but the concentration in the kitchen goes up to like 1,500 or 2,000 microgram per meter cube. So huge exposures among these women. We have conducted several studies where acute coronary syndromes in rural women is about 6 to 8 times higher compared to the women those who are using natural gas in those areas. So some of the interventions are like improved roofs, which reduces some emissions. We have also tested that and published some of the studies where respiratory health are protected, but not absolutely. You need the cleaner energy. The climate change is just adding the problem. The heat waves, these heat waves are the tip of the iceberg. Every day people are dying because of the heat and increasing temperature. That needs to be considered, not just we wait for the heat wave. So this is just, give alarm time to time. So we haven't investigated how air quality is influenced by the climate change, and that is should be investigated under current, under the local conditions. And this is where we keep on blaming why and how the air quality of Lahore is deteriorating. And the simple solution we find to close the schools. Some next time we'll say, you evacuate from Lahore, for example. But those are not the solutions. Close the school for 2 days and evacuate from there. So the solutions are something else. You need to look at the three policies I talked about. So moving on, just a few slides on water and health. One of the major problem in water is the quantity of water, not the quality. Quality is a secondary thing. The quantity of water as per population is decreasing. If you look at the red line, we were water stressed to water scarce country now, and the population is increasing simultaneously. That's a major developmental issue. That's a major development issue. We don't have enough water. So one will not have enough water. Obviously, you can't maintain the quality of water. So first of all, the quantity of water. And the floods is just adding fuel to the fire, and the contamination as well as the availability of water becomes much more problematic with these floods. So major water-related concerns in Pakistan are obviously, first of all, the quantity of water and the storage of water, but also biological contaminants, nitrates from fertilizers, the pesticides, arsenic, fluoride in certain areas, arsenic in certain areas as well, and salt water, sea intrusion. And these are like, as I showed before, the contamination from the industries as well as residential areas, no regulations, which are causing a lot of pollution. Arsenic is one of the problem, which causes skin lesions, but internal cancers also, and cardiovascular diseases. And we investigated that along the Indus River in Khairpur with geographical, measurements. And what we found, if you see these red dots, and there's an Indus River, the red dots are along the Indus River, and the blue dots, which has low concentration or under 10 microgram per liter of arsenic, the wells are safer or safe, are away from the river. So that's the pattern we saw, that wells along the river have higher concentration and the population living are at higher risk. So just the last slide on intervention. As I said, quantity of water is a major problem, and it's alarming problem, I would say. Large dams are needed to solve larger problems and we have to increase the water storage beyond 30 days. India has about 180 days of, and some of the countries have more than 300 days of storage. We have just 30 days of storage. So small dams are also needed to solve local problems, like you have droughts and where you can solve that problem. So we need both dams. Sometimes we say there's always a debate, we need large dams, we need small dams. And we say, some people say we need small dams, others say we need large dams, but probably we need both to solve the problem. Water body preservation through regulations and monitoring, and then the quality control of water and water management at the household level. So I'll just stop with this, I think, and back to you. Thank you so much.
Thank you, Dr. I'll come back when all speakers have spoken in the interactive session. Now, to talk about climate change, crisis management, and environmental health, I would like to invite Lieutenant General Umar Mahmood Hayat, retired. He's the former chairman, National Disaster Management Authority. Sir.
Thank you very much. I hope I'm audible.
Yes, sir, you are. Please.
Thank you very much. Thank you. It's a very good initiative. At least we are starting to talk about it. From my perspective, with my experiences in disaster management, I will focus on how this has impacted the overall disaster context of Pakistan. We all understand that Pakistan is probably one of the most disaster-prone countries, but our context of disaster was always thinking about disasters in terms of hydrometeorological disasters, or in terms of earthquakes, and in terms of droughts and such like things. I remember taking up the issue of health with policymakers, where we were suggesting that a major health emergency in the country would also result in a natural disaster. And we did not get a lot of traction towards this. But, you know, lo and behold, COVID happened, and everybody realized how big a natural disaster such pandemics and such activities can become. There is a lot of international work also going on in various spheres of disaster management. In fact, in one of the international panels in which I am also participating, they're focusing on what they're calling polycrisis. And with polycrisis, they say it is the 4 C's. And the 4 C's include COVID and pandemics, climate change, conflict, and cost of living, and the impact that it is having on communities, and especially vulnerable communities across the world. So a lot of work is actually being put into such concepts and such ideas to come up with solutions and to come up with recommendations. You see, environmental health becomes a serious issue for Pakistan. I think Dr. Saab has very amply highlighted the science of all of it and the impact that it is having on the health side. Now, the risks, as were highlighted in terms of environmental health, include air pollution from industrial emissions, vehicular traffic, water contamination leading to waterborne diseases, inadequate sanitation, contributing to hygiene-related illnesses, and exposure to hazardous waste. These factors can contribute to respiratory issues, waterborne diseases, and other health problems, emphasizing the importance of addressing environmental concerns for public health improvement. Because of our population and the way that our population is growing, I was attending a seminar a couple of days back where there were projections that by 2040 we'll be when Pakistan will be 100, we'll be 400 million people. So unless we decide in a very realistic way on what needs to be done, and we create that awareness within our policymakers, half-baked measures will not work. In another 23 years, Pakistan will be 100 years old. So with a population of 400 million people, think of the impact that the current crises are generating, and think of the impact that any crisis like the current crisis would generate on a population which is 400 million. NDMA on its part has done work on such issues. There have been policy recommendations from NDMA side on various issues, on land use issues, on water use issues. As Dr. Saab highlighted, we've become a water scarce country. We paid no attention in the cropping patterns that we adopt. So we use cropping patterns where or crops which are which use very high waters or use very high levels of water. So there needs to be work done on the cropping patterns in Pakistan. Some good news that is coming out is that we are seriously now looking at carbon credits, and that is more out of compulsion of business or compulsion of generating foreign exchange revenues for Pakistan that we've started looking at this. I'm working with a company which deals with food products. So we are currently sort of doing agriculture with about 10,000 acres, and we're planning to take it up to about 75,000 acres. And we are very seriously looking at how we can introduce systems and policies where we are able to draw on the carbon credit market. The Green Corporate Initiative that the government has launched, I met them a couple of days back, and they were very interested in finding out our experiences, and they want to take this on, this carbon credit thing on very seriously at the government level. So these are some positive developments that are happening. Now, when I was researching this, I thought, you know, what policy recommendations can one offer? And I have some suggestions in terms of the policy recommendations that can go in for environmental health related issues. And to top it all would be air quality management. And I think Dr. Saab has explained this in a fantastic manner. So we need to implement stringent regulations to control industrial emissions and vehicular pollution, encourage the use of cleaner technologies, and promote public awareness campaigns on health impacts of air pollution, strengthen monitoring systems to assess air quality regularly and enabling timely interventions. And obviously the second part also Dr. Saab highlighted, which was water quality assurance. So we need to enhance water treatment infrastructure to ensure the provision of clean and safe drinking water, implement comprehensive monitoring systems to detect and address waterborne contaminants promptly, promote community-based initiatives for water quality management and hygiene education. At the end, I will put all of this together and come up with a recommendation on how we need to engage the government and what the government can do in this. Sanitation improvement also becomes imperative. Invest in improved sanitation facilities and waste management systems to reduce the risk of hygiene-related illnesses. Develop and enforce regulations for proper disposal of waste, emphasizing the importance of sanitation in preventing disease. Another important area which Dr. Saab also alluded to is hazardous waste management. Dr. Saab was talking about Lahore. You go around the ring road where the industry is, and you see the entire hazardous waste going into River Ravi. So we must establish and enforce regulations for the safe disposal of hazardous waste from industries, promote eco-friendly practices, and encourage industries to adopt cleaner production methods, collaborate with businesses to implement waste reduction and recycling programs. We also need to focus on public health education, integrate environmental health education into the healthcare curriculum to enhance awareness among healthcare professionals, conduct public awareness campaigns emphasizing the link between environment and health outcomes, empower communities with information on preventive measures and on healthy lifestyle choices. You see, with research and surveillance is another point where we must invest in research to understand the specific environmental health challenges in different regions of Pakistan. Strengthen surveillance systems to monitor the prevalence of diseases associated with environmental factors, utilize data for evidence-based policymaking and targeted interventions. Now, this would also require an intersectoral collaboration. So we need to establish intersectoral collaboration between healthcare authorities, environmental agencies, and other relevant stakeholders, foster partnerships for joint initiatives, resource sharing, and coordinated efforts to address environmental health challenges comprehensively. Climate change, we've discussed. We started paying attention to climate change in the last couple of years. There are some very good initiatives that have been taken. But to think that if we continue down this path, regions like ours, in not too distant a future, there will be areas which will become uninhabitable. So the challenge and the danger is very clear and present. It sort of hits at the very core of the way that we live. And unless we change our habits, we are headed down a very destructive path. So we need to develop strategies to mitigate the health impacts of climate change, including extreme weather events. Those of us who live in Rawalpindi, Islamabad, around this summer, the feel-like temperature shot up to about 54 degrees, which I had never seen during my lifetime. So it is a very real and present danger. So we need to integrate climate resilience into the healthcare infrastructure planning, ensuring preparedness for emerging health risks associated with environmental challenges. Now, some efforts are being, taken by various departments of the government towards this. But overall, the picture is not very good. Where do we stand in terms of our SDGs? Where do we stand in terms of our health-related SDGs? Where does the world at large stand in terms of SDGs? So the kind of recognition and the kind of urgency required by policymakers around the world is not very forthcoming. So that is what makes such symposiums, such discussion extremely important. You see, we have systems available we have a standalone system with the Pakistan Met Department. They also, have the capability of monitoring air quality to an extent. We have a standalone system with some other departments, with SPARCO, which monitors crops, which monitors other related activities from the space. With the current land management system that is being introduced at SIFC, they also have satellite-based information where they can target each region and come up with what kind of crop utilization, what kind of resource utilization is required. So these are standalone systems available, and there are some others also. If you go to NDMA, they've done a very good job in creating a National Emergency Operations Center, and they are slowly and gradually integrating some of these systems. What we must focus on, and what I will also definitely plead with NDMA, would be to integrate all of these systems and have these markers of environmental health also built into these systems, so that we can monitor and apply corrections, and we can, it is imperative for all of us to make an effort to bring a positive change in the thought process of our policymakers in recognizing the urgency of these issues in Pakistan. Thank you very much.
Thank you, sir. You're very right in saying that the overall picture is not at all good. To invite our next speaker, Mr. Rafi Alam, he'll be talking about environmental laws and environmental health, the situation in Pakistan. Sir, over to you.
Well, first of all, thank you very much for inviting me to this symposium. And I also want to thank the speakers before me, Dr. Saab, General Saab, for their very insightful and comprehensive views. Please let me share my screen. I've got a presentation that I want to focus on. I will be focusing my comments actually on the air pollution situation in Lahore and some of the legal issues surrounding it, and hope to talk more broadly about climate change in the policy discussion afterwards. We have something in Lahore that we call the Lahore smog, which I want to point out is actually not smog and is not Lahore either. Being a Lahori, I confess that we often think that our entire universe is within the city itself, and that's not the case. Smog is a particular type of air pollution. When you have a certain humidity, a certain dew point, and something called an inversion layer, which traps the smoke over a locality, causing a smog situation. What we have in Punjab, not even Punjab, what we have is bad air quality throughout, not just Pakistan, but the Indo-Gangetic Plain. We're also somewhat disadvantaged by the geographic location that we're in, because we have the Hindu Kush, Karakoram, Himalayan mountains to the north, and the Deccan Plain to the south, which sort of puts us in a trough. And every winter, as temperatures get colder and hot air is unable to escape upwards, taking some of the pollutants with it, we become beset with this incessant air quality issue, this air pollution that we see. And Dr. Fatmi correctly pointed out that citizens of Lahore lose as much as 5 to 7 years of life expectancy on account of air pollution. This is quite startling because Pakistan is not an industrial country. By the way, I should also point out, most air pollutants are greenhouse gases, carbon monoxide, sulfur dioxide, things like that. And so it's startling to note that we have such a critical air pollution situation with a relatively less industrialized country. And as I pointed out, this is a regional issue. We'll see air pollution being a problem throughout the South Asian area. And the scale of this is also spectacular. The World Health Organization posits that about 9 million people a year, right now, prematurely lose their lives on account of air pollution throughout the world. And that over 90% of the citizens of the world are exposed to unhealthy levels of air pollution. And while this is true, please realize that this distribution of destruction and death is not equitable. It is concentrated in the urban areas of Africa and Asia. So most of these 9 million people a year are us in South Asia. It's you and I, our relatives and friends. Now, focusing on the law of air pollution, we have, after the 18th Amendment, all 4 provinces adopting their own environmental legislation and having limits on air pollution from industry as well as ambient air. And I've pointed out over here, we have the gaseous emission limits or the gaseous emission quality standards for all the provinces, which go after, or they scan for 16 different pollutants and also give you the limits of each type of pollutant over here. So this is concerning industry. We also have ambient air standards, and these scan for 9 different pollutants. Please forgive me, I only have 8 over here. I think ozone and lead are left out. But I want to focus over here that not only do we have the pollutants, the maximum permissible allowable concentration of those pollutants in air before it becomes unhealthy, as well as the method of measurement. And I'll come back to this method of measurement in just a second. But let me focus just a bit on this particulate matter 2.5, which are these very small particles of dust, 2.5 microns in diameter, only a fraction of the width of a human hair, that are small enough not just to be inhaled, but also to pass through the lungs and into the blood system. These are incredibly carcinogenic. And our law requires, or rather mandates, that clean air have annually no more than 15 micrograms per cubic meter, and within a 24-hour period, a 35 microgram limit per cubic meter. Let me now show you readings I obtained from Lahore's Met Department, where the EPA has an air quality monitoring device. These are from 2018, but the facts remain the same. These are half-hourly PM 2.5 measurements from November 2017 all the way to November 2018. The blue lines are the PM 2.5 measurements, and the orange horizontal line is the annual average that we see. And this, I want to point out, shows that we don't have a season of smog. We have a year-round air pollution and health emergency. It's very clear from the data that the EPA itself has. Now, interestingly, in Punjab, the AQI measurements, which AQI is another means of measuring air pollutants. You take 4 or 5 major pollutants, you have an algorithm that puts them together, and it presents you one single figure to understand how bad the air pollution is. Now, the EPA on its website now regularly publishes what the air quality index in a few parts of the city of Lahore are, let alone the rest of the province. But what's interesting is that if you look at these readings over here, you'll see that 102 on Jail Road is considered satisfactory on the EPA website. But if you look at the bottom, and if you look at the bottom left, you look at the EPA's own classifications of AQI, you'll notice that 101, 102 does fall within the green, light green area, which is satisfactory. But if you compare these classifications to the United States EPA's air quality index, you'll find that 102 is actually unhealthy for sensitive groups. What we've done here in the Punjab is we've recalibrated the AQI so that instead of 50-point increments, we work on 100-point increments, thereby underreporting the severity of air quality in Punjab. This is a massive fraud on the citizens of the province, because it does not allow citizens to appropriately take the measures they need to be able to protect their health and the health of their loved ones. Beyond this, we have now private sector monitors. I've just pointed out the EPA only has a handful of monitors in all of Punjab, let alone its cities. But through private initiatives, people with their own small PM 2.5 monitors that connect to the internet, we now have a number, I think 16 in Lahore, private air quality monitors, which can gauge PM 2.5 levels and generate AQI for the city. Now, the problem with this, as far as the EPA is concerned, is that these low-cost monitors do not conform with the prescribed method of measurement in the environment quality standards for ambient air. And so the EPA Punjab denies the veracity of any of the small or low-cost monitor networks that exist, and absolutely refuses to accept the readings that it consistently generates, showing Lahore to be one of the most polluted cities in the world. So what we're finding at a public sector level is denial of the problem and obfuscation by underreporting the severity of air pollution. I want to point out that it's not just a question of the type of monitors. It's a question of science and how you approach the issue. This is a map of NO2 emissions in South Asia prepared by Greenpeace for the United Nations' first International Air Quality Conference in Geneva in 2018. This is based over 4 months of study. NO2 is produced 4 months of study in the summer of 2018. NO2 is produced every time you burn a fossil fuel. So you'll see that the region is covered in NO2 emissions. The black dots are coal-fired power plants. The red dots are thermal-fired power plants. And so these satellite images or satellite-based readings can also provide some sort of understanding of how air quality is functioning. And you don't have to rely on these reference standard machines that comply with the preferred mode of measurement of air quality. We need to think beyond this preferred mode of measuring air quality, because if you comply with it, you have to invest in machines that wind up costing not tens, but literally $100,000. And Pakistan doesn't have that sort of money. Punjab doesn't have that sort of money to set up these expensive air quality monitoring stations throughout the province. And so we need to think beyond these prescribed modes of measurement to find some manner of recognizing and reporting real time what the air quality situation in the province and in the country really is. Let me drill down here. This is a little bit of a close-up of the same map showing you North Punjab and a bit of Khyber Pakhtunkhwa. You'll notice that Lahore at the bottom right is red. It's actually one of the top 50 NO2 most polluted cities in the world. And that sort of corresponds with the level of industry and also the automobile in the city. But what explains this plume of red between Rawalpindi and Peshawar? What explains this plume of red here in Khyber Pakhtunkhwa in a place called Pizu? Now, let me tell you. The Rawalpindi-Peshawar route is the GT road and indicates the low quality diesel fuels that we use in the transport sector, especially in the goods and public transport machines, automobiles that we have. And in Pizu, we have the Lucky Cement is a coal-fired cement plant. As a matter of fact, just south of Peshawar, you'll see a red spot in Kohat. That's the Kohat Cement Company, which also runs on coal. It's a coal-fired cement plant. So it's images like this, it's technology like this, which is freely available online, which should allow policymakers to step forward from the prescribed modes of measurement and begin asking questions about what to do with the transport sector, what to do with desulfurizing our coal-fired power plants and coal-fired cement plants, and including these other hotspots as well, how to move industry onto more renewable types of energy. The debate shouldn't be about the quality of the machine. The debate should be how we can transform our economies and our practices to a more clean air future. And beyond this, this satellite image is startling because I'm not only showing you the amount of pollution and where it is, I'm giving you the names of people who are now involved in the pollution. So our policymakers shouldn't sit on their hands in the face of this public health emergency, and should actually use technology to their advantage, benefiting the reference standard monitors they have with a low-cost monitoring system that can supplement their understanding of how bad the air pollution situation is. Beyond this, we've had some studies in the Punjab of where air pollution comes from. Now, granted, the slide over here is from a 2018 study sponsored by the Food and Agriculture Organization of the United Nations and conducted by the Agriculture Department in Punjab, which suggests that about 45% of the pollution year-long in the province comes from the transport sector, and that industrial emissions account for about 25%, in the power sector, about 12%. These are the major contributors of air pollution. And yet, if you read the newspapers in Punjab, in Lahore, on a daily basis, you'll find that the policy implementation or the action that's being taken about smog or air pollution is overwhelmingly against farmers who conduct crop burning and against brick kiln owners. And while I don't deny that they have a contribution to the air pollution problem, they are not the major source of air pollution. We need to focus our policy responses on the major sources of air pollution, invest in our petroleum refining industry so that it can produce something more than the Park 2 or sub-Euro 2 standard fuel, which is currently available, and produce the Euro 4, Euro 5, Euro 6 standard fuels that are otherwise regionally available. That will make a dramatic difference in the quality of air pollution. We need to focus on renewable energies and transitioning industry as well as domestic energy demand from fossil fuel-based electricity onto renewable energy. And this is crucially important and can be done because right now NEPRA tells us that solar and wind energies are the cheapest types of energies available in Pakistan compared to all other forms of electricity. Now, one last thing, and I do doff my hat to Dr. Fatmi and the Aga Khan University because it is the one place in Pakistan that's conducting research on the public health dimensions of air pollution. But we really are blind in the rest of the country as to what they are. This particular slide was shared with me by Dr. Arvind Kumar of the Healthcare Foundation in New Delhi. And he's a surgeon, he's a cardiac surgeon who's been working on air pollution issues for the last 20 years. And he showed me the slide on the left is a healthy lung. And he explained to me that when he started his practice about 35 years ago, most people who came to him or who had lung cancer were mostly men who had either smokers or had a family history of lung pollution. The image on the right was a startling one shared in 2016. This is a woman who grew up in Delhi with no family history of lung pollution, lung cancer, nor was she a smoker. And yet she died of lung cancer. So the devastating effects of air pollution are in front of us. And we need to do something, especially understanding the health impacts of air pollution. We're very, very bare on the epistemological studies that we need to be able to show policymakers just how bad this is for the vast majority of the population and spurn them into action. This is an election year after all, and we should be talking about air pollution and climate change so that these should be mainstream political issues given the severity and the burden of disease, that the burden on health that they carry. And yet we find our politics are completely somewhere else. This needs to change, and it needs to change very, very quickly. Now, Pakistan is not the only country that has faced air pollution. Lahore is not the only city that's faced air pollution. Cities and countries that have include the United States, Los Angeles, California, London, Stockholm, Paris, even Chinese cities, Beijing and Shanghai over the last 8 years have dramatically improved their air pollution. Mexico City did a turnaround in about 15 years. And in all of these places where air pollution has been successfully tackled, we have seen one common thread, that civil society, the people who vote the policymakers into place, civil society have had a shared vision of a clean environment and clean air future that is more sustainable and durable than the 5-year election cycle. And we must inculcate this type of awareness in civil society in Pakistan if we hope to have some sort of breakthrough when it comes to air pollution. Thank you very much.
Thank you, Mr. Rafi, for elaborating and giving the thoughtful presentation and sharing another perspective with us. We are joined by Senator Shahid Rahman Sahiba. I would request you to kindly deliver your keynote address on climate change, environmental health, and the challenges to the policy.
Thank you very much. I wanted particularly to hear what Afia has to say. She's a real grassroots champion of climate change, and I appreciate your having her and myself and putting these issues on the map. I won't be long because I know there are better speakers than me lined up with you. First of all, I want to say, look, the WHO has said internationally that health issues are the most impacted by climate change. And this is something that is not really seen as front and center in the discourse on climate change, but really the most shocking statistics and the ones that should shake us out of the normal kind of lassitude we have in terms of climate action or the race towards inaction, as I call it, is what the WHO has said. So I really appreciate that they've gone ahead and said that, it is one of the world's greatest health challenges, and it is linked entirely to climate change. Now, having said that, coming into Pakistan, we've been making this argument, as Afia knows, and she's been with us in all the key forums, and inshallah will be everywhere. We want to look at a situation where Pakistan is saying, and is rightly so saying, that we are a very low emitter of greenhouse gases, which is a fact. And so yes, the whole context of climate justice and how we end up paying the price for other people's consumerism and bad habits and fossil fuel addictions poses a threat for us. So we do pay that price. But having said that, this is November. And November in Pakistan is very, very focused on, everybody's mind should and does focus on the devastating consequences of air pollution, which are locally caused. And 80% of it is locally caused. And let's not pretend otherwise, okay? Because we have to take responsibility for it. Everything is not about narrative. A lot of it is about actions, which is why I think we need to appreciate 3-4 things. One is that health impacts are most direct. You can certainly start ingesting toxic water and get diarrhea because the water is one of the most polluted things in Pakistan, whether it's arsenic or whether it's the groundwater we're looking at. But even surface water that we, consume, a lot of it comes from the Indus River, as do many of our of what we ingest. And so from the ocean, and the Indus River is the fourth most polluted, water body in the world. That's something we need to look at, and we are entirely responsible for. But moving on to, air pollution, which is on my mind always every November, and even before that, look, three things. One is that it is generated locally mostly. And this is just the bumper sticker on that. Secondly, it's become a serial killer for Pakistan. Okay, it's become a serial killer in the sense that the amount of deaths that you're looking at has been very exponential. It reduces life expectancy across Pakistan by up to 2.7 years, which is a very big number. And now we have a situation where, PMT 2.5, the concentration in Lahore, which is how we measure it, is so high that it has gone beyond all the charts. Okay, now we can say that it is Lahore vies with Delhi most of the time for being one of the two top most polluted cities in the world. Now, these are very dubious titles to be debating and ranking ourselves on. And I think one of the things we have to recognize is that there are guidelines for air quality, for clean air, and that clean air is a right. You can't be in a situation where children are told not to go to schools. Children are, put indoors for a whole season because we can't manage our air quality. Older people are hospitalized. I mean, there were numbers like in 500s in one day that were hospitalized in Lahore. And I remember saying it on my social media. Somebody contacted me that I know, and they said, well, I'm one of them. I'm 60 years old and above, and I'm hospitalized because of the air quality. I've lived here all my life. I cannot breathe anymore. So it is fundamental to not just our health, but our but it places greater limits on our mortality, on our ability to achieve anything, on our society. And it says a great deal about our society as a whole, that we know what's wrong, but we are unable to act on it. Now, when I say serial killer, the Global Alliance on Health and Pollution estimates 128,000 Pakistanis dying annually from air pollution-related illnesses. This is a staggering number, and I believe it is understated because a lot more morbidity and mortality rates are hitting the ground in Pakistan. They simply go uncounted, and that is particularly respiratory infections, particularly lower respiratory and indoor air pollution, which causes at least 55,000 deaths annually. Again, undervalued, undercounted. So these statistics really are a wake-up call, and they make air pollution, air quality in Pakistan a serial killer, in my view, because it is silent, it is creeping up around you, and it is not being seen, unfortunately, as a cause for urgent action. So you can't start acting in November and saying, now we're suddenly getting rain clouds and we're doing this and we're doing that. It's not going to work. It is not going to work. And it is not fair to start saying that we're going to close schools and close doors. I mean, how many days will you keep people inside? How many days will your motorways be closed? How many days will your airlines be unable to drive? How many accidents will there be because of poor air quality? And public health should be front and center of clean air actions. Now, clean air actions are, there are many, okay? And the reasons for smog are many in Pakistan. We know all of them. Those are, smoke from brick kilns, and particularly in the Punjab, which is, which houses many such factories. But bigger than that is vehicular, emissions. Bigger and equally big are the big big polluters, the heavy hitters like cement, tires, coal, plastic, these are the big emitters. And literally, I think it's time to start looking at the carbon monoxide in our lives as a public health emergency. And that is where I think the needle will shift. Last year, when I was health minister, I was like, okay, this has to be out, a national clean air policy with consultation from the provinces has to be out well before November so they can start taking remedial actions. Even in 1 year, it will not in 3 months filter down, but air quality is extremely responsive. The good news is air quality is extremely responsive to a reduction in toxins and pollutions and particulate matter, the 2.5 M that we talk about, and it responds very fast. Anthropogenic action has for centuries defined our experience, but when we actually take action to reduce pollutants in the atmosphere, you'd be surprised at how quickly things change. Now, if you remember the COVID year, the COVID interregnum, the whole world went through. When airlines had reduced flights dramatically, did you notice that there was an appreciable change in the color of the skies, of the air we breathe everywhere? There was an appreciation of that. So honestly, it wasn't just us all imagining a utopian scenario where you can dial back many of our mistakes. It is actually quite possible and achievable. And here's what I would recommend for for Pakistan immediately. Yes, I know that we need to roll out electric vehicle policies. They cost quite a bit. They're not easily affordable by the common woman or man. And frankly, they're imported. They're not assembled here. And it's very difficult, therefore, to access parts, to get the charging on the grid stations that is needed, unless all that kind of ecosystem is laid out that enables easy use and switch over from, gas guzzlers to petrol guzzlers to this, to electric vehicles, to clean energy. And the charging stations for it are there, and the vehicles are made affordable. Only then will a switch be made. You can't just make a policy in paper and say, here we have an electric vehicle policy and Pakistan should fully make the switch. It doesn't work like that. We have to create the enabling conditions. And so before we get there, we get to the fiscal situation with two-wheelers. We're starting with the two-wheelers and three-wheelers. But before we get there, what are low-hanging fruits you have in your policy envelope, right? What suite of urgent actions can you take to appreciably start reducing? And if you start acting now, maybe next year's Lahore and Karachi will see changes in their air quality by the time winter comes. And winter makes us all particularly vulnerable because the particulate matter rises to the surface because of cold air. Now, we already have a framework for improving air quality. There is no excuse. There's no policy absence. Okay, there wasn't. I took it out last year. I said, it's like the National Adaptation Plan. I feel a derelict in my duties, having held this post for even 15 months, I have to take it out because this is one of our biggest problems. There we go. So we have the framework. In that, yes, it's taken out from Islamabad, but what that means is to enable the provinces to be real actors and to be stakeholders in this policy creation. It went through 3 tiers of consultation with each province because each province has a different economic ecosystem and they have different challenges, particularly Punjab with proximity to Indian Punjab, where they both burn agricultural residue and create for both areas a real new problem, particular to that area. So the burning of crop residue is only one part of the issue. Before we start blaming each other's countries and absolving ourselves of responsibility and action, it is a real issue. It is a big pollutant and it forms highly polluting black carbon, which has very adverse effects on human health. So getting that out of the way, stop burning it in your area. Let's give that a start, right? So that's one of the things. Then the other thing is that toxic metals there are cement, plastic, and other factories that are already many of us from the Climate Caucus were able to shut down. Either we ask them to change their technology, which reduces the sulfur content, and you go from black to white smoke like you do in the zigzag technology in the brick kilns. Those two can be converted. Half of them in the Islamabad area have been converted. So I think it's doable. The environment protection agencies are critical actors in this particular area, and they must be made far more, they must be given teeth, honestly, to act autonomously, to be able to hold a particular actors. If there's any unit, industrial or residential, emitting the kind of smoke we're talking about, toxic smoke, then they should be able to take action without anyone intervening over their heads that this is a powerful entity. Because there are many residential areas using the homes, clustering homes as small industrial units. They're misusing the land, and that is also what's going on. Plastic bags and resin, etc., all being produced now. So that's brick kilns and industries. Thirdly, you have, and of course, the burning of agriculture residue. Now, you can also start very simply looking at the fuel being used. Now, that's essential. That's been something that's been talked about for a long time. And you need to shift from a minimum Euro 5 by 2025. These are standards and gradations of fuel as to how much sulfur there is, and other gradations of what pollutes our atmosphere. Now, we can do that because work has started. There are a few stations that already do that, use that fuel. If it is made mandatory, and for that, you don't need lawmaking. You simply need the province to say, this is mandatory by X time, give people 3 months, 4 months, whatever it takes to make that conversion and start using that fuel. Now, if that's a problem, I think we need to hear about it. But do you hear about it? No, I don't hear about it. I'm not hearing about it anywhere that we have to import it or it's a grade we can't manage. No, at least start talking about it. Fourthly, there are simple things to do for vehicles such as tune your vehicles. Now, that's entirely doable. That can be imposed very easily by local government. You don't have to set up a whole new policing structure for it. As we have advised, all you need to do is, say, for instance, when people go to get their motor vehicle sticker or tax, right? The inspection goes up. Have you tuned your vehicles? Do you have the polluting silencers and all that in your vehicle, in your rickshaws? Yes, no, you get your sticker based on that. Very simple. That in itself, that low-hanging fruit action will give you a lot of payback in reducing the pollution in your air. Then you have waste, okay? You can immediately, I've already talked about ban burning waste, but I think at least 10 cities can do that by 2025 with proper landfill sites, and start sort of making plans for waste to energy models, at least start the journey. Once you start the journey, then there will automatically be vendors and manufacturers, and there's many biogas people interested, industrial agents interested, and I believe we can do that if we even look at the waste to energy technology. So it gives you a virtuous industrial cycle to move. You're going into cleaner energy, and you're also reducing the burning of waste. Lastly, you have residential. This is again easier, one of the easier, less big macro things to do, which won't cost you $1 billion. What you need to do is simply start looking for eco-friendly building codes and materials to improve indoor quality. And also, when you're cooking using cook stoves, you try not to burn the high emission, the kerosenes, the bad, the wood, especially, that people pick up in semi-rural and peri-urban areas. A lot of that is still happening. So you're not only reducing your forest cover by denuding the area of timber and burning it, you're also adding to your indoor air pollution. So that all is very important, building codes, indoor pollution, the cook stoves you're using. And if some very small subsidy is given to these conversions, it will happen. Because most of the actors and decision makers in this situation, in homes, in lower income homes, which are using these cook stoves that pollute and actually even kill sometimes when they explode, are women. And women are actually fairly rational actors when it comes to saving their families or to saving the money, and their disposable income is very tight, and they want to make the better decision in the longer run. They're better users of natural resources. They naturally conserve things better because they have to carry the water, grow the food, and actually save the food. They're not blowing it, say, on a satta market on the weekend. So I think these are easy to implement. And a lot of it is just the governance of existing codes. If you are able to implement or just put mind to it, if the government starts messaging, if it starts giving importance the whole year round, you will see a shift. And I believe it is very important because public health is related entirely to the toxins in your air and water. So with these words, I don't want to go on. I'm sorry, it was very, very practical minded, but I think that's what's needed at this point. There's no, there shouldn't be a smog of policy on this, that oh, this is very difficult. We have to put in huge, detoxifiers. No. You have to take actions. And the other thing you need to do is just start putting in air quality measurement in the air. Now, in many cities, I was in Faisalabad the other day, the citizens had actually started putting them up, collecting the money and pooling their resources and putting up an air quality measuring instrument up. So it was stating the air quality on X road and Y road, and big businesses were part of the solution. So, the CM can call a meeting, all the big businesses come, they know that eventually they will be taxed, and their exports will be taxed if they don't comply. So standards have to start changing for climate compliance in many ways, more ways than one. And emissions and reduction of pollutants is one of them. And I think we need to bring all citizens on board, but particularly big business, you start with that. So should government, so should the public sector, and we will get to a path where the journey begins and you start seeing change being adopted. Citizens will then also start thinking about it. Right now, there isn't any thinking, there's just panic. And I don't think that works to suddenly start saying, okay, let's get rain cloud. Can we afford that? Is that a permanent solution? No, you need sustainable solutions. And those are the most, sometimes often the easiest to implement. And just because it doesn't cost too much or it's round the corner doesn't mean it's the best solution. It's not the best solution. So it's time for us to look at that. There are some very expensive solutions which first world countries are looking at and using. We will have to get to those, but this is, as I said, is a journey that Pakistan needs to begin, especially the cities. So thank you for doing this. I hope this is what you needed. And I look forward to hearing about the outcomes of your meeting today.
Thank you, Senator Sahiba, for giving us and taking time out from your precious schedule. Afia Sahiba, I'll come to you. Please, if you could enlighten us about the way forward in the advocacy related to environmental health.
I haven't muted it. I'm going to run to the other thing.
Afia Sahiba, you're on mute. Kindly unmute yourself.
So I said, like when we were growing up, we used to hear on TV कि सिलसिला वहीं से शुरू होता है जहाँ से मुनक़ता हुआ. So I will start over. In the interest of keeping to your time, I will sort of just now flag some issues rather than elaborate them, because then that would take time. And many of the things that have been said. Now, if I really didn't think that air quality issue was something very, very important and something very topical and timely, I would probably say this has hijacked the discourse of the health discourse, the overall health discourse. But be that as it may, it's very important to talk about it, and all the points that were made by Rafi as well as Senator Sharif Rahman were very pertinent. As I was saying, we have to actually try to disengage the conversation about climate change from the conversation about environment. Because when we put everything on the doorstep of climate change, we somehow feel so overwhelmed because this is a huge global issue, and we think, we are too puny to be able to do anything about it. Whereas a lot of our issues, as acknowledged by Senator Sharif Rahman, are of our own doing. Yes, climate change is anthropogenic, but so are our environmental issues. Climate change is not forcing us to use, fuel with high lead content, high sulfur content. It is not helping our governance structure to go all lax and not implement the already laid out national environmental quality standards. So if we, to pull up our socks as far as the governance is concerned, a lot of these issues can also be addressed because the laws exist, the standards exist. All it is needed is the implementation of the standards. Now that is easier said than done. I do know that they require resources, they require capacity building of the staff. They also require, and help me out here, Rafi, the updation of the way laws are implemented. Unfortunately, our laws don't embed the concept of carrot and stick, and they only want to apply the stick. But our fine structure is so archaic that if you are harming something to the tune of 50,000 rupees, you can get off by paying a fine of 500 rupees. So that doesn't really prove as a deterrent. And this is what has been happening in the case of forest cutting. This is what is happening about the pollution of our water sources by big industry. So we have to look at these things as well. Now, as I mentioned, I started, like I said, I will be flagging issues now because I think there isn't going to be much time to elaborate on them. So the first issue I mentioned was the issue of microplastics in our oceans, especially in our big marine bodies, and with them reaching our food chain. So that is something which requires urgent action, and that has to be the cleaning up of our water bodies at source. Now, our water bodies are the ones, especially our sea, is being polluted by the direct discharge of effluents into it. And these are chemical effluents. These are your municipal waste and your, all kinds of effluents are going untreated. Even your solid waste is going there. So there has to be a mechanism to stop the addition. You can't just go on these big fancy cleaning drives. They're very good for optics, but they produce no result because after a couple of days, again, you are in the same situation and everything is just about as polluted because the source isn't being tapped. So the industry is polluting the Indus River, as Sharif Rahman mentioned. I have traveled on the Indus River, and if I, actually overlay her comments onto the map that Rafi showed, which showed that the highly polluted sites are along the river. Now, rivers are supposed to be the repository of fresh water. And yet that water is so polluted that away from the river, you're finding fresh water, and nearer the river, the wells are more toxic. So, I mean, how do you even get your head around that? And that is something that is easily fixed through governance and through implementation of the existing laws. Now, the other big issue in Pakistan is of heat. The rising temperature, and we have the medical journal saying that beyond 50 degrees, the capacity of the human body to cope and function normally is severely compromised. And we have been hitting the 50-degree mark earlier and earlier. So we had Nawab Shah break the world record. I think it was in April. Then we've got in March, we've got to hit 50. And every successive year is hotter than the previous one. And this is a huge issue because it not only compromises your ability to function normally, The heat also, and this is something where, I would really like Dr. Fatmi to educate us more when there is another opportunity like this. Your vector-borne diseases move to the higher latitudes because that kind of weather is more receptive to for them to flourish in. So we never used to have dengue. It started from Sri Lanka, and we had to take help from Sri Lanka to help fight it. But dengue is going to the areas which are now hotter than they used to be historically. So these kind of vector-borne diseases are likely to increase, and newer diseases are likely to come. And this, of course, also contributes. The heat index going up compromises our ability to work is because of the living spaces. The building materials that we are using are absorbing heat. The cooling devices that we are using to keep those heat absorbing buildings cool. It's like that little mouse on a wheel. We need to jump off that wheel and put a stop to at least one of those things. Either we use building materials that don't require that kind of cooling devices, which are making the outside air hotter. So this is also something that we need to look at. What are the materials that are weather compliant, that are climate compliant? I'm not talking of the climate change per se, but there are things that we can do to fix this. And here, I'm not even talking about the issues related to the emissions, but yes, those who can afford it, or large public buildings, large private buildings, offices, factories, they require cooling for for production. And then where is the hot air that those cooling devices throwing? They're going out, and the outside air temperature rising means that the person who is functioning in that environment his health is compromised, his or her health. And we have a large number of people who work outside in the open air. The factory work, the agricultural workers, there were those who are in the construction industry. So what about their health? Then the third thing is that there is not adequate research. There are just references to the possibility of the heat index rising having an impact on reproductive health. So there needs to be more research on that. I know Dr. Zeba Sattar was trying to to gather researchers to look into these aspects. There's Dr. Nausheen Anwar, who is Karachi Urban Lab, has done many studies related to heat, because that is what is more relevant to people in Karachi and its peri-urban areas. So we need to actually look at those things. Yes, we do need a lot of trees. According to, I think it was the FAO reading, where our forest cover is 1.25. The recommended cover is 25. So I don't know whether we will get there in my lifetime, but the point is that is also something that needs to be addressed. But what also needs to be addressed is what kind of trees are going to be planted. On the pretext of greening Karachi, we had a tree, an invasive species planted. It greened the city. But again, I would like Dr. Fatmi to correct me on this if I have the wrong references, but I do have references from medical bodies which say that the Conocarpus, which was planted across Karachi, has led to respiratory diseases. So we plant trees for them to absorb pollution, but here the pollen from the Conocarpus is actually exacerbating the respiratory diseases in a city which already has very high vehicular emissions. And when that pollen particle goes and settles on the existing pollutants from exhaust fumes, then the size becomes higher. So there's another reason for the ppm 2.5 to go up. So there are multiple problems, and they are all interlinked, and they are all intersectional. So we look at issues in silos. We think this is the issue of the Commerce Ministry, which needs to get in the right kind of vehicles and put in the transport policies. And then we think that this is the water bodies are an issue of maybe WAPDA or other such organizations, but they're all intersectional. And unless and until we look at the intersectional problems, we will not be able to solve them in that same manner. And when we talk of the SDGs, not one SDG can be solved whether it is related to wash, whether it is related to health, whether it is related to climate, if we do not link them with each other. Now, 2 or 3 quick things that I do want to mention. One was the mention of the availability of water, and the other was of the quality. So availability in the sense of quantity, and the other of quality. Yes, we need to fix the quality of water. Again, that has been polluted by human action, and that can be done through good regulatory practices. As far as the quantity is concerned, I know that Dr. Fatmi said small and big dams. I think the days of big dams are over. And by the way, for your smog, people don't take into account the contributory factor of having large water bodies to the presence of fog, because the water vapor is also considered as a part of the greenhouse gases. And that water vapor does not dissipate in the winter months because there are fewer sunlight hours. And this is why the smog then intensifies. This is not all doom and gloom. Having said all these things, we have 2 programs which the government of Pakistan has initiated, has approved, not yet initiated, but approval means that, now at least funding can be sought and they can be projectized. One is the Living Indus program, which is looking at the cleaning up of the Indus, not just cleaning up and restoring the biodiversity, but cleaning up in the context of the discussion we are having, which is very important. The other is the Recharge Pakistan. And Recharge Pakistan will actually be able to give us the kind of water storage that we need, but not necessarily surface water. Because now the consensus is that we have 2-3 large aquifers, the size of the proposed, or rather on the wish list, the Kalabagh Dam. We can store as much water underground and take it out when we need it. So this is why now that is the integrated water resource management calls for that kind of an intervention, and I'm glad to see that Pakistan is actually moving towards that. Now, one last thing that I would like to flag here, when we are talking about the health issues, I have not heard the mental health being mentioned over here, either in the context of disaster or either as a consequence of all the other physical health impacts which lead to morbidity, to depression, and related issues. And we do not have an understanding of the link of mental health issues with these things. During disaster, we saw a lot of such issues, coming to the surface because they could see disaster all around. People who have lost their livelihoods, their homes, they do go into depression, and there's very little counseling available, very little therapeutic help available. I can quickly point to 2 examples that these are not, immediately after this disaster, these things are long term. I was in Chitral at a site of Glough, and the villagers were talking of one man, and I'm going to give you just 2 examples. One person who saved himself when people shouted at him that the torrent was going to come and hit him. He ran up the hill and he saved his life. But from that day on, he has been in severe depression and is crying because he saw his father's grave fall open because of that rush of water, and the shroud hanging over. For as many days as the shroud was visible, that man was in severe distress. And after that, when the water receded and the entire devastation of that village was apparent, this man could only think of his father's grave. The other person who, in that very same, and this I'm talking of only one small village in a remote part of Chitral. The other person, after they tried to rehabilitate, they tried to fix the electricity wires, he got burnt, through a short circuit, and his limbs had to be amputated. Now, imagine the kind of lifelong trauma that he is suffering from. So, when we look at disasters and we look at physical health issues, we need to also look at these issues. As far as reproductive health is concerned, the number of pregnancies that went up during the floods because the women had no recourse, and the number of, the problem pregnancies that emerged during these 2022 floods. Yes, this was the same in 2020. So, I mean, we have to, I'm just flagging these issues that when you are talking about health and climate change and environment, kindly look at these issues here. So I'm not going to go on and on about it. This is a very long discussion. I just want to flag these issues here. Thank you.
Thank you, Afia Sarkar, for giving us a very real-time picture of the issue. Now I will request all the panelists to kindly turn on their video cameras so we could have an interactive session for remaining time. Sir, here I would have to make two announcements. One is that we're starting 1,000 plantation drive of 1,000 plants in Islamabad under the Pakistan Health Parliament platform. And secondly, taking the lead in the initiative, Pakistan Health Parliament is going to establish a council on environmental health, and will dedicatedly work on this issue. From all the panelists, whatever they have described, there are 5 to 6 areas that need reforms. One is the population policy, transport policy, industrial and energy policy, agriculture policy, interprovincial coordination, and waste management policy. The picture overall is not at all good about Pakistan. We are taking initiatives, but when it comes to producing results, we stand nowhere. So, Dr. Zafar, I will come to you first for your concluding remarks.
Yeah, thank you. So good to know that Pakistan Health Parliament is taking initiatives and forming a council for environmental health. We need more and more such effort and concerted effort and more regular and continuous effort, not just one-time effort to do this. One thing, when you're doing planting trees and all that, very good, very nice, and these we should do more and more. Afia has raised this, and I want to raise this also. So planting trees is great for global climate change. It sequesters carbon dioxide. It improves the dust, decrease the dust, which contributes to air pollution to an extent. But air quality issues are a little distinct, and we need to be aware of that, and we need to be make that distinction clearly. So it's about fuel, it's about fuel quality, it's about the vehicle quality, the industrial machines quality, so the efficiency of those machines which we where we are burning these fuels. And then on top of that, the management of these vehicles and road transport and all of that. So these are the major contributor to air quality, and sequentially, some are low-hanging fruits, as Sherry Rahman has, Senator has said already, and that's true. You can manage the traffic, you can do some mass transit, you can do, these are some of the things which you can easily do. You can improve the quality of the fuel which you're burning, and that's reduce sulfur content. And you can ask the 3 companies which provides the fuel to reduce sulfur content. And that's a policy and regulation you can make and ask them. You can, it's already 300. You can charge 302 rupees or 303 rupees for that matter. But it will improve the quality of air tremendously. So those are the things which we have in hand, and we can do it quickly. But there are structural changes which requires a longer-term plan and longer-term strategy. So those needs to be considered, which is also urban planning. For example, I'll give you an example of Karachi. So there's a wind corridor which is now being constructed, the Malir corridor, there's a lot of construction which is going to happen in the Malir site. And there's a wind corridor, so the sea breeze actually clears the Karachi air quite frequently. And if that structure is built and allowed, then that wind corridor will be blocked, and you will have a situation like Lahore soon in Karachi as well. So those are the urban, planning things which needs to be every city. So we are just talking about like Lahore and Karachi, but all the other cities which are becoming mega city, Faisalabad and other smaller cities, there's no plan. There's no planning for the expansion of those cities. So those needs to be in place right now, and that can be done and made available to all the people with laws and regulations, so that we don't have another 10 Lahore cities in next 10 years. It is expanding, as you can see. So there are things which are in our hand, and one of the most important tool in environmental control are the regulations. And Rafe and the team, those who actually in the regulations and laws, I think can play a greater role, and they should get into this. A group of lawyers or a battery of lawyers are needed to sue people for the wrongdoing, for the contamination of water bodies, for the overall emission standards in the industries and all of that. That is the way forward, I think, and we should have a concerted effort on that. So there's enough evidence in terms of health. I don't think we need to put a lot of effort on that and say, the health is being and how many people are dying and all of that. We can keep on accumulating that, but there's time now for action. So I'll just stop here.
I'll come to you, Jalsa, with a question that we know what are the problems. We know what are the solutions. We know how bad picture is overall in Pakistan. What is the way forward? What we have to do and how we can change.
Thank you, Ahmad. It's been a very informative discussion. I'm thankful to the other panelists. I have a unique perspective because I've worked on the other side of the table also. And having worked on the other side of the table, I now very firmly believe that a strong and vibrant civil society, which puts pressure on the government and on the agencies dealing with these issues to implement the laws that are there and enact new laws that are needed for bringing about this change. So a strong and vibrant civil society is the way forward in this. Having worked on the government side, I understand the limitations that are there. I understand absolutely the focus that policymakers have, and focus on these issues very limited. This focus on smog will go the day the smog goes. The focus on climate change comes when there is drought in Sindh and Balochistan, when there are mega floods in the country. As soon as the flood waters subside, even before they subside, the focus goes away. So only a strong and vibrant civil society and people like Doc Saab, like Rafe Saab, like Afia Sahiba, are the people who can create that awareness, not only within the policy-making circles, but also within the middle class. So the more the people that you involve into such discussions, the more awareness that you create, the stronger that your civil society is, the more you will be able to apply corrections where they're needed. Thank you.
Thank you, Jalsa, for emphasizing on the role of civil society in shaping the overall outlook of our society and our country. Rafi sir, I'll come to you with a question that how local acts are not enforced and Pakistan Environment Protection Agency at national level is playing its important.
Well, the Pakistan Environment Protection Agency only operates to the extent of the Islamabad Capital Territory because environmental matters are subject of provincial domain now after the 18th Amendment. So, frankly, is climate change. A lot of the climate issues that are listed out in the climate policy of Pakistan, the adaptation issues like agriculture, like irrigation, food security, transport, what have you, these are all matters of provincial governance control, although listed in a federal policy. Now, provinces can't act on those initiatives listed in a federal policy because these are expensive interventions. Introducing new irrigation schemes, introducing better agriculture, having better urban planning that promotes public transport are all subjects of provincial governance that require funding from a provincial assembly passing a bill in a finance act. The problem with the federal government's policies with respect to climate change and to a large extent even air pollution is that they are signing checks that the provinces have to cash without properly interacting with them and getting their feedback to do so. Look, we are right now in terms of global warming about 1.1, 1.2 degrees warmer on average on Earth than we were before the pre-industrial level. And scientists are telling us right now that the amount of greenhouse gases in the atmosphere today, if we were to stop everything, would still lock in a 1.5 degree temperature increase by the end of this decade and a 2 degree temperature increase by the middle of this century. That is an undescribable amount of death and destruction. And we're going to face it here in Pakistan. You know, last year's floods in 2022, there's a study by Imperial College London that points out points out that about 50% of the intensity of the rain that fell, and this is rainfall that created a 100-kilometer lake over Sindh and Balochistan, that 50% of the intensity of that rain is due to the 1.1 degree of global warming that we've experienced. Pakistan and Pakistanis are suffering greenhouse gas emissions of the global north, and this is only going to get worse. The monsoon is going to become more unpredictable and more intense. We're going to see Glacier Lake outburst floods and floodings in areas that we haven't experienced before. We're going to see heat waves, the likes of which we've never experienced. Now, we're talking about wet bulb temperatures where you take into account humidity. Take, for example, Brazil today, where a 42 degrees centigrade recorded on a thermometer when counted in with the humidity that was present was actually equivalent to 58 degrees centigrade temperature. No human body can survive that. And our cities, where millions and millions of people live, are totally inequipped to deal with such heat events, let alone flooding. Pakistan is facing a grim disaster in the future when it comes to climate change. And our response? Turn on the television and see what it is. We're talking about corrupt politicians. We're talking about Tosha Khana watches. Last year, during the floods, the Pakistan Air Force, during the floods in September, the Air Force placed a $450 million purchase of fighter aircraft. We need to prioritize our governance. We need to have our elected representatives, instead of hiding and fighting for their lives against these unprovable allegations of corruption, to be able to do their jobs and represent the people who elect them. This needs to be done. Like, you look at what's happening on the ground. We have all these climate policies. We all have all these air pollution policies. Everything's written on paper, but look where the money is going. Did we take money from the IMF to build the Barakahu overpass so that people can get to housing societies near Murray quicker? This type of silliness, this type of destruction, this is walking us into destruction, has to come to an end. We have to reform our governance. These are electoral issues that people should live and die in parliament for, not these other things that we're talking about. And until we can fix our governance, Pakistan doesn't have a hope to be able to face the type of climate disasters that its future holds.
Thank you, Rafi sir, for calling the right issues at the right time. Now, Afia sir, we have a last couple of minutes, and I'll ask the last question, as the question that the people are asking is a very long list. So, from the last point that Rafi was raising, It was about why these traditional media outlets are not using their platforms effectively for the advocacy. What is the hurdle?
The hurdle is the business model. The business model, there are only two kinds of media in Pakistan. There is the state media and there's the state media. The state media's Qibla is in one direction and nobody can deviate from that. And the state media's Qibla is the money. So do not expect them to. You see, again, it boils down to what Rafi mentioned earlier, regulation and the enforcement. PEMRA, which is the license giver to the electronic media, has, as a part of that license, a 12% airtime dedicated to public service messaging. Now, if you look at
we
statement
have
on the
we
Hello?
have listed these allegations on the mainstream media platforms, but how to bring digital media in this wave and movement for the advocacy of environmental health?
Actually, I think we need to be grateful to the digital media because it is only the digital media where you will see some kind of conversation of issues. The mainstream media, unfortunately, thinks that covering disasters means covering environment and climate, covering, so you will not see them other than at the disaster. You will not see these meaningful conversations, the difficult conversations, the controversial conversations, where, like Dr. Fatmi had mentioned about the dams. That's a controversial issue. There are benefits of dams, but there are downsides of dam, which we now are seeing apparent in the lower part of the country. So when have you seen these kind of debates where people are not trying to rip each other's face when talking about contentious issues? So it's the digital media where you are seeing at least that kind of this 2022 floods. They started in July. The mainstream media jumped onto this in August. When did we know that in Balochistan the hill torrents were being so devastating? When did we get to know about what was happening through Rojhan? It was through the digital media. We have the highest teledensity. Amongst the highest teledensity in the whole world. That is the tool that we are not using effectively. And those people, wherever they could have a charged phone, they were sending videos. Yes, they were for asking for assistance, but at least the word got out that this is a village that has been washed away, and here the water is coming here and it is rising. And so I would actually say thank you to the digital media. But as far as the electronic, again, if PEMRA enforces that 12% airtime for public service messaging for a country that has not been able to move out from the top 10 bracket of the vulnerability index for the past decade and a half, if you make a priority list of issues that need to be discussed in those 12% airtime, don't you think that would find its space over there? But it doesn't. So then that is also the onus again is on the regulator to ask what is happening on that 12% airtime. At least that is going to get some eyeballs and maybe get some conversation going within the widest spectrum of society. Because right now what we are doing, we are preaching to the choir. We are not, spilling over this conversation to the uninitiated. And that is something that needs to be done.
Thank you so much, ma'am, here as we conclude. And I thank you everyone for participating in and speaking for the very pressing issue of the day, environmental health. And here at the concluding remarks, I will state our commitment to environmental health is a testament to our commitment to the well-being of future generations. We have the knowledge, the technology, and the collective will to make a difference. Let us advocate for sustainable policies, embrace eco-friendly practices in our daily lives, and inspire others to join us in this noble cause. The choices we make today will, through time, shape the world, and our children and grandchildren will inherit. Let us be remembered as a generation that took a stand, that understand the gravity of the environmental health crisis, and that worked tirelessly to leave behind a planet that thrives, not just survives. Thank you, everyone.